Now, another study, not from the surgical literature, now moving and transitioning into the more general critically ill patient population. This was a study that really revolutionized critical care, the so-called early goal-directed therapy study published in 2001. And what this study looked at was patients primarily with severe sepsis or septic shock that were admitted to the hospital through the emergency department. And using a very protocolized approach to resuscitation, particularly volume resuscitation, versus a conventional approach to resuscitation, using primarily the central venous pressure and the mean arterial pressure as guides for fluid administration, then patient outcomes were compared in the two groups. And then looking at outcomes, although the primary outcome of all-cause mortality at 60 days was not significantly different between the two groups, several of the secondary outcomes were favorably influenced by the dry or conservative fluid strategy. And then finally, the last very important observational study that we'll discuss during the webinar today is a study that comes from the Bouchard group in the United States, which is a collaboration of investigators from 5 institutions. And finally, and very importantly, what the Bouchard study showed was, despite the fact that the patients who were treated initially with CRRT were more critically ill, as indicated for one thing by a greater degree of fluid accumulation at the start of dialysis, despite the fact that this patient group was more critically ill, fluid balance or fluid overload was much better corrected with the continuous modality versus the intermittent modality.